When you hear the word cancer, that's very scary. That's now you're thinking you're going to die. You know, what's going to happen with your kids or your family or whoever you live around you. So definitely change your whole life perspective and how you even live that life perspective. That's why we really don't kind of see a patient just as a yes, you have breast cancer, or yes, you just have a sarcoma on the scapula, or you have, you know, any kind of like endometrial cancer or whatever it is out there, head and neck cancer patient is really beyond that. It's really changing what the whole world feels like, right? From sleeping to what they put in the mouth, from, you know, support. It's really a completely different ball game. So we just have to put more of those pieces of the puzzle in this ball game to be able to just really win it. The information provided on this podcast for educational purposes only and is no intent nor should be used as a substitute for medical advice. Consult a licensed qualified medical physician for any issues concerning your health. If you would like to know different strategies to improve your quality of life during your cancer journey, this is the podcast for you. Welcome to Taking Charge of My Cancer podcast, where I'll be interviewing different healthcare professionals, cancer survivors, and I'll be teaching you different resources, tips, and solutions so you can get the best outcomes while dealing with a cancer. Welcome back to Taking Charge of My Cancer podcast, when we share inspiring stories, expert advice, and real conversations about health, healing, and hope. Today's episode is a little bit different. It's very inspiring. We are talking with an applied physiology and kinesiology student who is just wrapping up her internship here in physical therapy oncology and now preparing to become a physical therapy student soon. We will discuss what likes working with cancer survivors, the lesson learned in oncology rehab, and how this experience shaped her future, and advice for students who dream of entering the healthcare field. This episode is all about growth, purpose, and stepping into your calling. Please welcome our special guest, Camila. So Camila is from Miami, Florida. She's 22 years old and, like I mentioned before, about to graduate UF with a bachelor's degree of science in applied physiology and kinesiology APK and a minor in business administration, returning to the University of Florida to attend the DPT program this upcoming fall for physical therapy. She's been interning here for the past 4 months, back to Miami to travel, and also visit Tampa to help her sister open a new pediatric clinic in her free time. So Camila, thank you so much for doing this with me today.
No problem. Thank you for having me.
Absolutely. So tell us about yourself and what inspired you to study APK.
So, like you mentioned, yeah, I'm from Miami, Florida. I do have an older sister, and she is also a physical therapist and is also a Gator alum. So she also did APK. So she's 7 years older. So when she was doing her kind of learning, she used me as a guinea pig and was kind of reading things out loud. And I was like, people really like that's a job. Like that's kind of cool to learn because my parents are both in the business world. So it's a lot of computers, a lot of calls, and I thought that's what work was. So when she was more into the healthcare field, I was like, that's something I could really like. And then once I started going into the actual classes, I'm like, yeah, I could definitely do this. And that kind of just spurred the love, and that's kept going.
Okay, perfect. And what first inspired your interest in physical therapy? That's your sister?
Basically,
Yeah.
my sister. So as again, she was in PT school. She went to BU. She was using me, analyzing my gait, and just seeing everything I had a problem with. And again, I was just like really interested specifically on the specialization of the musculoskeletal aspect of it, because I never was really drawn to MD because just like not my style. But I think the physical therapy aspect of it is what drew me into the healthcare field. I don't know if I would go into healthcare if not for physical therapy. So,
Okay. So how did this internship shape your career goals?
so it really did confirm the love. I did have experiences beforehand, but definitely being in clinic, this is the longest I've been in a clinic, in the same clinic. And it just confirmed that like, I'm ready to go to PT school. And also it did give my pique my interest in manual therapy a little more because I'd never really saw it. I did pediatrics. There's not really a lot of manual therapy in at least the clinic I was in. And then some ortho places were kind of come and go. And then other places did have manual, but I didn't really get to see it that often. I saw mostly evals. So here you kind of see how appreciated manual is and kind of how the interaction between manual and then also like exercise prescription, it kind of comes and goes with their progression of them being here. And so it kind of made me want to get good at manual, even if my program doesn't really show it that much. I don't really know yet, but
okay. And I think they are much better. I think that they're now doing a lot more manual therapy that they used to do. So I think that you will get a good amount of it. What were your expectations before starting the oncology PT internship?
I was kind of scared. I was going into a lot. I had no experience in oncology. Luckily, I don't have any like family history in it, so I had absolutely no knowledge of it. And so I was just, I'll be open ears, open mind, kind of absorbing everything. And that's exactly what I did. So I didn't have any expectations, just that it was going to be a lot. And that's exactly what my first day was, I think, tumor board. And it was ER, PR positive. We were seeing scans. We were seeing, I was like, I'm in over my head in this. I don't really know what's going on. So slowly and thankfully for everyone teaching me and having the patience, they kind of are like talking to me in baby steps of what the world of oncology is. So
very good. What was the most surprising thing you learned during your rotation?
a lot, but I think basically a lot of people that come in here don't really know why they're here. And I guess that's kind of different from other clinics that I've been to because people kind of seek the help, but a lot of times because when you get that hard diagnosis, there's just so many appointments and it's like Victoria says, it's a full-time job to have cancer because a million appointments, million doctors, bunch of medications, insurance, fighting, and there's so many things. So they're just kind of at some point like, I don't know why I'm here, but I know you'll help me. So it's kind of our job to educate them and kind of explain to them our reasoning so they know why it's so important. And then we do a lot of patient education and lifestyle, which is just also something you kind of mention in physical therapy in other places, but it's really emphasized here for the sake of like recurrence rate and all and everything around it, which I think is in further questions. But yeah, just kind of how consuming a cancer diagnosis is, and then just the state of what people come here and they're like, I have no idea why I'm here, but I know you'll help.
Correct. And not only that they're overwhelmed because of cancer diagnosis, but it's because really oncology rehab hasn't been out there for too long. I mean, has been for a while, but hasn't been, it's growing more and more people hear about it and more people it's really utilizing as more, but it's not like, you have a total joint replacement. You know, oh yeah, I have to go to physical therapy, right? So definitely it's a field that is open more and more and more, but that's why the patient is even more lost in what they need PT, because we see them in the beginning before any even surgery, and they're like, oh, I haven't had surgery. I don't really know why I'm here. So it's just really doing all that education that we do. That's really super crucial. What was the most surprising thing that you learned during the rotation?
Oh, like again, a lot. I think it's really embedded with like new research because of course cancer research is coming out more and more and we are part of trials as well. I never really had a big part in research in other experiences that I've had. So kind of just like us also keeping up with it, but also kind of explaining to patients like, yes, that's the way that you used to do it, but a new research article came out and then we now do this and explain reasoning. So it's kind of like very up and coming. And like you said, it's kind of new. So I think that's kind of the most surprising thing of just like how much research goes into it and then how often we have to be part of it. And then that also will shape my future look in any type of PT of being up to date and kind of changing my ways to the new and better.
Okay, very good. What was oncology physical therapy differ from regular orthopedic physical therapy?
A lot. I actually thought they were going to be more common, but then I came in here and absolutely not. But I think the most important difference is that I guess why people go into PT and especially like ortho PT, it's you kind of see them often, like the patients often, so you build a bond and that's kind of the appeal of PT, seeing them 2 to 3 times a week. But it's even more so with oncology where you can have follow them through surveillance and it's years of having the same patient. You always have like, I've known this person since A, B, and C, and we've had a good bond and we've always been like this. So that bond kind of is so much more emphasized in this field. And I think that's kind of like a big difference from ortho other than the actual technical things around it.
I think it's just a life that is in the game here, right? When you have, I'm not saying that having an orthopedic condition is a good thing to have, absolutely not. For some people can be as traumatic as anything else, but yeah, you have a total joint replacement. You're gonna get over that, time of healing and more pain. And then every day you feel better and better and better. And then you're gonna see a light on the other side of the tunnel and you're gonna get better and you're gonna move on with your life. When you hear the word cancer, that's very scary. That's now you're thinking you're gonna die. What's gonna happen with your kids or your family or whoever you live around you. So definitely change your whole life perspective and how you even live that life perspective. That's why we really don't kind of see a patient just as a yes, you have breast cancer, or yes, you just have a sarcoma on the scapula, or you have, any kind of like endometrial cancer or whatever it is out there. Head and neck cancer patient is really beyond that. It's really changing what the whole world feels like, right? From sleeping to what they put in the mouth, from, support. It's really a completely different ball game. So we just have to put more of those pieces of the puzzle in this ball game to be able to just really win it. So that's part of it. How do you working with cancer survivors change your perspective on healthcare?
Yeah, so a big part of it is what you said. I always respected how hard that diagnosis is. Like you said, it's a big word. It's got a big weight on it. But also just their kind of attitude. You'd think that they'd be more defeated with all the appointments, with everything, with how many years that they have to be in it and how many surgeries that they could possibly have. But a lot of them come in here like very persistent, very tenacious, saying, okay, we're going to do this. We're going to do this chemo protocol and I'm going to get to, so it's just kind of really heartwarming. And you're like, why am I going to, a lot of people go like, oh, poor you. But it's like, why am I going to do you have a great attitude. I'm going to have a great attitude. Like, we're going to get through this. Like, I'm giving my all, you're giving your all. Why shouldn't we have a good, like, outcome of this?
Yeah.
So I think that's a big thing. And then on healthcare in general, I do appreciate kind of how everything moves together here. So we work with like the surgeons, plastics, and radiation, and kind of how all of that works together for that one person. And while they're overwhelmed, we are also kind of like working as a team, even though we don't really see each other. Like I've met them because I went to go see them, but I haven't met a couple people, but we all know this one patient. So it's kind of nice to be like, we're all in this for you. And that's a nice part about healthcare, and especially this diagnosis. But I will say I didn't know that much about healthcare is the insurance aspect of it, that we always have to, fight for patients and fight for things, because it could be down to like how you code something or whatever. Like, how dare they say that someone doesn't need treatment when we obviously see, so it is just really, that's a part that I wasn't really exposed to as like an observer in other clinics. But here you're kind of like, why wouldn't you get the treatment you deserve or covered? So that's something I need to look more into when I'm practicing.
Perfect. How important is movement and exercise during cancer treatment and survivorship?
Yeah, so I mean, in general, any type of like healthy lifestyle, exercise, nutrition will help all cause mortality, right? But in kind of cancer specifically, we do teach our patients that, it lowers the risk of recurrence, of edema. It could help your cancer-related fatigue. Like, there's so many benefits in general. So we kind of sometimes are the first people to ever tell them that, and they don't really know, and they don't know how to go about it. We have a million resources, but even that could be overwhelming. So I think just getting into the idea of like, what's comfortable for you, whatever can work can be awesome. And like, whatever way, like maybe your nutrition isn't up to par, but have you tried just doing it in a different sort of way? Like, let's try to fast, or let's try to have this in the morning or something. Just work with them. And then movement and exercise wise, it's just like, sometimes they don't even know what, like, oh yeah, I don't want to lift weights all the time, whatever. I can't do a barbell. And I'm like, sometimes you don't have to do a barbell. Like, you could do bands, and we kind of accommodate. And that, obviously, we have our benefits for it, but it is very, very important.
Okay. How has your internship prepared you for PTS school?
Very well. I do think I have a leg up. Of course, in oncology, I think it's a very unique experience as an undergrad to have. I do not take it for granted. I definitely feel kind of nice and tall being like, I had 4 months in oncology PT, and kind of knowing the aspects around it, and also having an interest in it early on instead of figuring it out during school when we might have not even an elective present. Like, now I know to go for that. And then also a leg up in documentation. I've never really been able to document in other places because it's just not my place. But now as an intern here, it's kind of an expectation. And I'm now familiar with the hospital system and everything. So just having that leg up and having that familiarity will kind of just come a second nature when it comes to PT school. And when I do my rotation somewhere else, I feel more prepared.
Very good. Excellent. And I think part of it, the beauty of having the students here for undergrad is that you guys spend a lot of time with my PT grad students so they always learning from each other, practicing in discussions, and you guys has been such a great team. So definitely you come up into PT school with a much more advantage into like, oh yeah, I already know how to do range of motion. I already know how to do manual muscle testing. I can only know how to do bioimpedance. I know how to do circumferential.
Yeah.
There's so many things that it's gonna be like when you are there and start your classes and they start kind of going over that, you will be like, oh,
Yeah.
so that would be great. Do you think oncology rehab will still be part of your future career?
I do really have an interest in it. I do like the population with it and the whole nature of it. Definitely, I want to go into something sort of specialization. I liked pediatrics, but I also really liked oncology. So hey,
Maybe another
open
one.
book, but I would really like to come back here
Awesome.
at some point or any other oncology.
That's awesome. That's awesome. Why should students consider internship in specialty areas like oncology?
So, like we said, I mean, the whole interview basically of just like the patient population is different, and you'd think it'd be more so kind of like ortho and just with a more sensitive topic, but it really is completely different. And I think as students it's not really an open opportunity that we can have to be with these, I guess, more sensitive diagnoses. So having this opportunity, like I definitely tell students to jump at it, don't take it for granted because not a lot of people would give you this. And we're fortunate enough to have UF Med Plaza. And also, I mean, our clinic in general has a lot of different specialties that you aren't really allowed to be in for most of the part because it is just so hard for students to be involved in specialty areas. But I do think it is very important for someone to have that experience in PT school, even before PT school or something like that, to kind of just at least know of it, even if that's not your interest.
Where do you see yourself 5 years from now?
Well, I'd be 2 years post PT school, so hopefully practicing somewhere, maybe oncology, maybe peds, maybe something else. But I don't know. We were talking about travel earlier. That might be something really cool, but just somewhere that I can be happy and in a position that I could move up in wherever I want to be in, prepared and have my connections and
Awesome. Well, I cannot wait to see you then. And I'm sure that you will do amazing in PT school. And I would love to have you following that path of oncology. I think you have a heart for it. And it is so needed because we need so many PTs out there working on this type of a specialty. Is very super grateful. And patients are very, very grateful to just be able to have somebody like us to help them through mitigate a lot of these kind of rough symptoms that cancer treatments can give to them. So Camila, thank you again for being part of the podcast. Thank you for amazing 4 months to be here with me as an intern and all your help. So I really appreciate it.
No, thank you so much for having me. You've been an amazing CI and you've been so patient with me and teaching me things hands-on and just having a chat with me when I'm curious. So
Okay.
I appreciate it.
Absolutely. And thank you, everyone. So just continue following the podcast. You can, become followers. So that will only help for this to continue grow and bring more speakers that I will give in a lot of education to not just patients, providers, as well as caregivers and students who just really want to learn more about oncology. So you take care and until next time. Thank you so much for listening to the latest episode of Taking Charge of My Cancer podcast. If you have not already, feel free to share this with more people so they can benefit from this information. If you would like to connect with me, see the information on the podcast description. See you later.